Hi there, my name is Dre, and I would like to welcome you back to my channel if you've been with me before. And if you are a first-time visitor, then hello, and welcome to the space where I talk about things that are relevant in the healthcare technology world. So today's video, I would like to talk a little bit about TEFCA. So TEFCA is the Trusted Exchange Framework and Common Agreement. So some of you may have heard of it, and some of you may have not had that acronym tossed out lately, but I think sort of moving into the spring policy sort of season, as it's becoming known by, TEFCA is going to be talked about quite a bit more in the next several months. So I thought I would have a bit of an overview on what it is. So we're talking about US healthcare policy. So for those of you that are watching from outside of the United States, just for context, this does apply to the US only, but it will have sort of impact on the healthcare technology space overall. So I think it's important for everyone to sort of have a basic understanding of what it is. So TEFCA was really created or initiated off of a section from the 21st Century Cures Act. So that Cures Act was passed in December of 2016, and Section 4003B indicates that the national coordinator needs to convene an appropriate public and private stakeholder group to develop a trusted exchange framework for trust and the policies and practices that go along with that. So I have the actual language up here for you to see. You also can certainly go ahead and Google Section 4003B where this is talked about. I'm not going to go through it in detail, but that's how this whole thing got started. So when they're talking about sort of looking at developing a framework, it was important to understand in the healthcare landscape where things were at. So what was the starting point for the framework development? So following the December 2016 release of the 21st Century Cures Act, the American Hospital Association sort of initiated a survey that took place in 2017 that looked at what methods were being utilized for the electronic exchange of health information. So in that survey, which I will link the results to below, they found that 78% of hospitals are using more than one method to electronically send patient information. And that about 40%, give or take, were using 5 or more methods, which seems incredibly sort of challenging to maintain, not just from a cost perspective for an organization, but also from a regulatory compliance and privacy and security perspective. So having 5 or more is a lot. They also found in the survey that 61% of hospitals are receiving that responded are receiving records using 1 or more methods. So a lot of them are, almost 80% are using more than one to send, and 60%, a little bit higher than 60% are using more than one to receive. So there definitely are multiple methods out there. So as part of this and as part of their other sort of research and understanding of the landscape, the ONC created 3 goals that they wanted to have underpin the development of TEFCA, and those were to provide a single on-ramp for nationwide connectivity, to make sure that electronic health information, or EHI as it's often referred to, securely follows you when and where it's needed, and to support nationwide scalability. So the framework needs to achieve all of these things. So with that, the framework that has been developed, and it is in draft, it hasn't been finalized yet, so 2 drafts have been put out so far, is based on a set of 6 principles, so 6 underlying principles that are going to achieve those 3 goals. So the first one is to adhere to industry and federally recognized standards, policies, best practices, and procedures. The second is to conduct all exchange and operations openly and in a transparent manner. To collaborate with stakeholders across the continuum of care to exchange EHI, even when a stakeholder may be a business competitor. The fourth one is to exchange EHI securely and in a manner that promotes patient safety. ensures data integrity, and adheres to privacy policies. Fifth is to ensure that individuals and their authorized caregivers have easy access to their EHI. And the sixth principle is that the exchange of multiple records for a cohort of individuals at one time in accordance with applicable law to ensure identification and trending of data for the purpose of lowering the cost of care and improving the health of the population. So these are the 6 underlying principles that sort of make up the framework and really are driving the language and the contents and the overarching structure of the framework. So the common agreement component, so again, the framework is in place. The common agreement is sort of a quote unquote contract to adhere to it. There's 3 components to that, or 3 component sections, so 3 groups that are 3 layers that are attached. So the first is the minimum required terms and conditions. So those are known as MRTCs, and those are going to be developed by the ONC. So the second one is the additional required terms and conditions, the ARTCs. Those are going to be developed by a recognized coordinating entity, or an RCE, and then the ONC will approve those before they're sort of put into practice. And the third component, which was added when the second draft of the TEF agreement came out, is the QHIN technical framework. So that's known as QTF. And this really talks about the actual technology and sort of the rules of the road, if you will. So who are the stakeholders that we would anticipate utilizing this TEFCA sort of framework overall? So who are the people that are going to be interacting with this, and who are the people that are going to be providing information into it and receiving information from it? So it's pretty much going to be anyone who is sort of has a real stake in electronic health information. So government agencies, public health entities, providers, individuals, payers, technology companies and their developers, health information networks. So really it's meant to create a structure and a sort of overarching agreement and playing field that's leveled for everyone, and that on-ramp is really for all individuals who are interacting with EHI, again, in the US. So what does the structure look like, and how is it actually set up from a framework perspective? So it starts with the RCE, and that role was put out to tender in mid-2019. So it was awarded in September of 2019, and that will be filled by the Sequoia Project. So the Sequoia Project is the RCE for TEFCA. So they will have oversight into making sure that the daily operations, operational mechanisms, and the sort of governance and everything is being adhered to. They're going to oversee the QHINs. So there are multiple QHINs that will participate, and all of them will have oversight by RCE. Within the QHINs are going to connect to each other for the data exchange. So the data exchange would occur from QHIN to QHIN. And each of those QHINs, and there's no defined number, there's a set of guidelines and rules and requirements to become a QHIN, but there isn't a restriction on how many of them can be there. So each of those QHINs is made up of multiple participants, and the participant groups are things like public health agencies, HIEs, health systems, so larger sort of entity type groups. And then within that, a participant group is made up of participant members. So the members level is where you'll find the providers, the payers, the pharmacies, the smaller sort of groups that are making up a system. So you've got the participant members that roll up to the participants that roll up to a QHIN, and then that QHIN can have an exchange of information, quote unquote, a conversation with other QHINs. So this framework is meant to be in place for, or is proposed to be in place for certain purposes of exchange. And those cover things like treatment, individual access to your data, public health, system utilization, a determination of benefits, business planning activities, quality improvement, quality assessments. And you will notice that some of those have asterisks beside them. Those asterisks indicate that that's a grouping or that purpose. It only applies to those that are designated as covered entities or business associates under HIPAA. So if you're not defined as a covered entity and business associate or business associate, then the TEFCA exchange, the purpose of exchange doesn't apply. So the exchange and methods that are proposed to occur within this framework, so the EHI exchange methods are a broadcast query, so sort of a question out to all QHINs to say, I am looking for all data on X. They are meant to be a targeted query, so they're support a targeted query where a individual QHIN or a sort of lower level participant or participant member is identified, and you are to say, I need this particular encounter from this particular facility or this date range of things, so a targeted query, as well as a message delivery push. And that message delivery push was also once again added only in the second draft. So the originally first draft that went out for review was just the query ones, and the push was added in the second draft. So now we've got both. So what does this timeline look like and where is TEFCA actually at? So as I mentioned, it has not been passed yet. It is still in draft form. It was created, sort of initiated off the 21st Century Cures Act from December of 2016. The first draft of the framework went out for review in January of 2018. So you'll see, 14 months after they were asked to create a framework, that's when the first draft went out. Public feedback and some sort of revisions and rework came in. A second draft was actually sent out in April of 2019. And that's when the QHIN technical framework and the push method were added. As I mentioned, September of 2019 is when the RCE was identified. And again, that's the Sequoia Project. And we are expecting the first draft of the common agreement, which is that second part. So now the framework is there, and we've had public comment on the framework for a while. And now we're looking at the agreement, and what does the agreement look like the mandatory terms or minimum terms and things like that. So that first draft is expected to be released in 2020. So we would anticipate that would happen earlier in the year as opposed to later. So whether that happens, in the spring or towards early summer has yet to be seen, but when it does come out, this is sort of the trajectory it's going to follow. And you'll also sort of start to see, as policy gets more talked about in the news, and as we have more drive towards value-based care and towards improving outcomes and reducing cost, you're going to start to see some of these policy components discussed in the general media and discussed just across the board with your health organizations. So it's a good idea to have an understanding of sort of where things are at and when they're coming out. So the big sort of hot topic of debate that's going on right now as it relates to TEFCA is, for the long-term implementation and adoption of this framework and common agreement, what will actually drive organizations to join? So why would somebody want to join the TEFCA agreement? So what would make an organization or an entity go through the process to establish themselves with a QHIN, or what would make a QHIN want to formulate and join the agreement? And that is where we have yet to see whether there will be business incentives to join or regulatory incentives. So that part is still an unknown at this time, but it is anticipated that within this 2020 policy year, we're going to have a very, very good line of sight into which one that's going to lean towards, or if it perhaps could lean towards both. So there are a lot of organizations, there's a lot of individuals, there's a lot of tech startups, pretty much everybody that is in the healthcare space in the US has started to pay attention. And TEFCA doesn't get talked about a lot, but it is something that's, as an underlying component, is important. So that's it. I will talk to you guys next time. Thanks.